website.
Hello and welcome to the Alabama Public Health Training Network. We're glad you could join us today for this program, Implications of the Affordable Care Act, Effective Strategies for Outreach and Enrollment. Our objectives today are to describe health insurance marketplaces and how they benefit consumers, discuss how to prepare staff for the changes coming through the Affordable Care Act, identify effective strategies for increasing insurance coverage among your target audience, and we'll discuss Enroll America's national Get Covered campaign. If you have a question about anything being discussed today, please call or email our faculty presenters at the end of the live broadcast. We've set aside a portion of this program to address your questions if you have any. Our 800 number and email address are up on the screen now, and they'll appear again later on in the program for you. Also, the handouts, sign-in sheet, and evaluation for this program are all available online. Don't forget, you'll need to register for this program in order to access those materials. Continuing education credits have been approved for both nurses and social workers for this program. The Alabama Department of Public Health is an approved provider of continuing nursing education by the Alabama State Nurses Association. The association is an accredited approver of continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. Instructions on just how to do this can be found at the bottom of the sign-in sheet. While content may continue to be relevant, CE credit will only be awarded for 2 years from today's date, which is July 24th, 2013. There's no financial relationship between the planners of this program and the speakers. There's also no commercial support for this program. ADPH does not endorse any product that may be displayed in conjunction with any activity that might be demonstrated, nor will the department discuss any off-label use of products. The Alabama Department of Public Health is now charging viewers who are not employees, contract employees, or retirees of the ADPH for CE certificates. More detailed information and specific instructions about this can be found on our website. Of course, registration and participation in our live and on-demand programs do continue to be available to you at no cost. Today's program is produced by the Alabama Public Health Training Center in collaboration with the Maternal and Child Health Leadership Education Training Programs at the University of Alabama at Birmingham, the University of South Florida, and Tulane University. If you'd like more information about the Public Health Training Center, you can visit their webpage. It is listed for you there on the screen. Let's go ahead and meet today's faculty presenters. I have seated next to me Jessica Kendall with Enroll America, and seated next to her in pink is Jody Ray. She's from the University of South Florida. Ladies, welcome.
Thank you.
It is a pleasure to have you both here. Obviously a hot topic going on around the country today, and hopefully you guys can provide a little bit of insight to it for us. And I know you have a lot of information to share, so I'm going to go ahead, and Jessica, you're going to get us started today.
Great, thank you. So I'm Jessica Kendall, the Outreach Director for Enroll America. And Enroll America is a national organization. We are nonprofit and we are nonpartisan. Our mission is to make sure that Americans get enrolled into health coverage that's been afforded through the Affordable Care Act. I'm starting this next October. So what we're doing is executing a national campaign called Get Covered America that I'll be talking about in just a little bit. But we're really using cutting-edge campaign strategies and building a large national coalition to make sure that people learn that coverage is available and learn how they can apply. So to give you all a little bit of background on what the Affordable Care Act actually is, there may be folks here who aren't so familiar with it. It comes under a lot of different names. People may have heard of it as Obamacare, as the Patient Protection and Affordable Care Act, the ACA. But regardless of what we're going to call it, what it really does is provide the opportunity for millions and millions of Americans to get affordable health coverage for the first time, really in a lot of their lives. They haven't had access to it before. It was passed originally on March 23rd in 2010, and the Supreme Court upheld it last July of 2012. So there's been a few things that have already been implemented, and I just want to touch upon those for folks that don't know. So right now, young adults can stay on their parents' plan until the age of 26. Millions of young adults have already been doing this for the last year since it's been implemented. It's a huge gain for families, a huge gain for young adults who didn't have access to affordable health care. And another thing that's changed over the last couple of years is that children can no longer be denied for pre-existing conditions. What happened before is if you had a child that had cancer, had a pre-existing condition, when they went to get health insurance, they could be denied coverage. So that no longer is in place. And people are no longer able to be denied for a lifetime limit. So previously, if you had a medical condition and it was extremely expensive, your insurance company could cap the amount that they would pay for it, and you wouldn't be able to get coverage for that anymore. So that's already changed. But coming in 2014, we have a significant amount of changes that are coming. The first is that for adults, so extending beyond kids, adults are no longer going to be able to be denied for pre-existing conditions. A number of folks have had either, been in a car accident, have a back injury, or have a more serious medical condition and aren't able to get coverage when shopping for it on the open market. So that's one of the changes that's coming. In a number of states, there's also going to be Medicaid expansions. And what that means is states are able to expand their current Medicaid programs. They're able to expand health coverage for low-income adults. So, for example, for a single individual, in a lot of states, they're going to have the opportunity to get free health coverage up until they make about $15,000 a year. Now, the last thing that's coming, and I think it's what we're going to spend a lot of today talking about, is health insurance marketplaces. Now, these also have a couple of different names. We may talk about them interchangeably, but there's marketplaces, and in the actual ACA and the Affordable Care Act, they're referenced as exchanges. So if I say exchange or marketplace, they're one and the same. Right now, in many states, you're going to have marketplaces. And what marketplaces do is they allow you to shop in an apples-to-apples comparison type of way for affordable, comprehensive coverage. Starting October 1st, so in less than 80 days, coming very soon, people are going to be able to shop for coverage. They'll be able to shop online. They can apply over the phone or in person, but they'll really be able to go online and view the coverage options that are available for them and look at what is the best option. What does that look like? And be able to do it in an apples-to-apples type of way. The other key thing that's going to be happening is while you're shopping for those health coverage options, there's going to be financial assistance available for a number of Americans. So if you're a family of 4 and you're making between $30,000 and $94,000 a year approximately, you may be able to get financial assistance to help pay for that comprehensive health coverage. So they are going to become more financially available to a number of consumers. So there's 3 different types of marketplaces. And those 3 different types of marketplaces, you may hear about this in the news, you may hear about it in your state, but the first one is a state-run marketplace. And what this means is that your state decided that they wanted to create their own marketplace, they wanted to set it up, and they wanted to run it. There's another one called a partnership marketplace. And this really goes into that policy piece of who's responsible for the application process, who's responsible for reaching out to consumers to let them know that there's plans available for them and who's actually in charge of those plans. So in a state-run marketplace, it's the state. In a partnership marketplace, it means that there's an agreement between your state and between the federal government to run that marketplace. And then there's federally financed marketplaces. So in these, they're also called FFMs, and I apologize if I slip into that lingo, but these are the states where you have the federal government running a marketplace. The moral of this story is, regardless of where you're at in the country, there is going to be a marketplace for consumers to shop under. So regardless of who's running it, you will have the opportunity to get to shop online or in person or over the phone for a comprehensive, high-quality plan where you may be able to get financial assistance. So starting this October, like I mentioned, you're going to be able to apply. Now, I'm going to throw a lot of dates out here, but because this is the first year of the program, what this looks like is this October, people can apply online over the phone or in person, and they can turn in that application. They can put in all of their information and decide which plan is right for them, choose it. Now, if they apply between October and December 15th, their coverage will start on January 1st. So just like right now, what happens for folks that have private insurance is there's one time of year when you can decide to switch your insurance plan, and that's called open enrollment. So what we're going to have moving forward is an open enrollment period, and that open enrollment period for this first time is going to last from October 1st until March 31st. Now, the plans actually go into effect starting on January 1st. And please feel free to follow up if you have questions. I want to make this as clear as possible, but I know I'm throwing a lot of information out there. So if you're applying between October 1st and December 15th, your plan will start January 1st. If you apply after the 15th of the month, your plan will start, or your coverage will start, the first of the following month. So if you were to apply on, say, January 1st, your plan starts February 1st. If you apply for coverage on January 17th, your plan will start on March 1st. So it's always starting after the first of the following month if you apply before the 15th. Again, please feel free to follow up if you have questions. What I really want people to hear when I'm saying this, though, is that people will have between October 1st and March 31st to apply for coverage, and that's that first window. That's that first window where we can get coverage, which means we need to reach as many Americans as possible during this first open enrollment period, because that's the time when people actually have the opportunity to apply online, or over the phone or in person. So what does this actually look like? Now, depending on your income, there will be, in many states, a plan available for you. And I say in many states because if your state did not go forward with the Medicaid expansion, and I have a slide in a little bit that will show where your state's at, but if your state didn't go forward with the Medicaid expansion, then if you're, below 100% of the federal poverty line, so if you're somebody who's making less than $10,000 or $11,000 a year, then you may not have a program available. But, so in many states, regardless of your income level, there will be a plan. So if you're an individual making between $15,000, or a family of four, we'll go back to that example. If you're a family of four making between $30,000 and $94,000, you fall into that middle bracket you see where it says exchange or marketplace with tax credits. What that means is that you can get financial assistance applying for a plan and paying your monthly cost. If you're a family of four making more than $94,000 a year, you can still shop online, you can get that comprehensive coverage, you can get that plan that will cover all the care that you need, but you'll pay the full cost of the plan. So regardless, there are now millions of Americans that will have access to affordable health coverage that haven't had that opportunity in the past. Now, if folks here have had experience applying for health coverage, or maybe have had experience helping families, families who are on WIC or who are on SNAP or food stamps, and getting coverage, you know that a lot of times you don't have an option available for parents, or a child has access to health coverage, but somebody else in the family doesn't. The new world that we're moving into is that families are going to be able to fill out a single application. And what you can see from this is you can fill out an application online, over the phone, or in person. And then behind the scenes, so the family won't experience this, behind the scenes what will happen is that depending on your income and where you live, you'll have, the parents may be eligible to get financial assistance paying for their health coverage program, so they would go into what on the slide says the exchange, also known as the marketplace, and then the child may go into whatever public coverage program your state has, which would be CHIP or Medicaid. Now, obviously, when families apply, they have the choice of whether or not they want to proceed. They have the choice of choosing the plan that's right for them. So all of those little arrows are really just trying to say that what the family's experiences is this seamless process. They will be able to have the opportunity to have behind the scenes figure out which program is best for them, which is really the funding stream available. Now, if people want information on what's coming and you're a consumer, or you know folks that are uninsured and you want to have an idea of what's happening in your state, you can go to healthcare.gov. I've gone there. I've signed up for information. You can opt in to have text messages sent to you, and it gives you a lot of great information about when you're going to be able to apply, where you can apply. Any kind of information right now as we're getting ready for October 1st that the federal government's putting out, you can sign up here on this website and learn more information. There's a lot of unknowns, and we are all working fast and furiously in order to make sure that people will have the opportunity to apply on October 1st, and this is a great way to stay abreast of what's happening in your state. So let's pause for one moment and take a look at what is actually happening in your state. So everybody who's listening should identify where you live, and what you're looking at are two different things. One is identifying what type of exchange or marketplace you're going to be living in. So I actually live in Washington State, so up in that northwest corner, you'll see that I'm a light blue and I have an M. And what that means is that we being those of us who live in Washington, will have a state-based exchange, and the M stands for Medicaid expansion. And what that means is that folks who are of a significantly lower income will have access to that for coverage. Now, where it says M is not that your state is going to have it. It means that there's an indication either from your state's governor or from your state's legislature that they would like to have it. A lot of states are still trying to pass legislation. So the dark blue is where you're going to have a federally facilitated marketplace. And then that middle blue is where you're going to have a partnership exchange. Again, the key message to take away is regardless of the color of your state, as a consumer, you will have access to health coverage that you can shop for online, over the phone, or in person. So regardless of whether or not your state actually does a Medicaid expansion, there's a number of policies that are being implemented that will make it easier for people to apply for coverage that's available for them. So especially if there's folks on the phone who, have worked in public health departments and have had people try to apply online or tried to get public coverage, there's been a lot of barriers for people actually making it through the system. Applications have been complicated. Applications have been very long. They've had to do in-person interviews. So there's been policy changes that have made it so that regardless of the Medicaid expansion, you'll still be able to have an easier application process. So they'll no longer be able to do an in-person interview or use your assets when looking at whether or not you're eligible for the current health programs available in your state. And again, regardless of a Medicaid expansion, this applies to all states. Here's what we know, though. People don't apply for programs that they've never heard of. So what you're looking at right now is take-up rates. And I think this is really important because regardless of what's coming on October 1st, if you've never heard that coverage is available to you, you're not going to apply for coverage. And what we've seen from other programs is if there's not outreach and marketing that happens to get people enrolled, even if the program is available, people aren't actually applying for it. And it doesn't speak to the quality of the program, it speaks to people not applying for something they're not familiar with. So we know that in the programs that have been more successful or had more people enroll in them that are eligible, and all of these numbers are based on the number of people who are eligible, we know that once that outreach and marketing happens, we see the numbers increase. We especially have seen this in kids programs like CHIP and Medicaid. The moment a state decides to move forward, and Jody will speak to this in a little bit, but when a state moves forward and works to reach out to folks, we see the numbers of people enrolled in programs increase dramatically. So what we know about the folks that are applying for coverage or will be eligible is that they have no idea this is coming. Enroll America did research to inform our national campaign that looked at who are the uninsured, what do they currently know about what they're going to be eligible for, where are they at. I'll talk more about some of the research later, but what we learned is that 78% of the uninsured, 78% of folks who would be eligible for financial help through the marketplace have no idea that coverage is available. So it really comes down to how well we reach out to uninsured folks to get them to apply and to let them know this is out there, of how successful this will be. And limited public awareness is our biggest barrier, right? I can't say it enough, but all of the people you have access to in health centers and WIC offices, and all of the other wonderful programs that you all work on, if you're not reaching out to the folks that you're working with, then they're not going to learn about this. And as the trusted messenger, you really become that key person to help people learn that there's options available and that they can have access to affordable coverage. So how many people are we actually talking about? What does that look like? What we know, and these numbers come from the Congressional Budget Office, they're estimating that over 15 million people will apply for coverage in that first year alone. But please, when you hear that number, keep in mind that you don't apply for something you've never heard of. So they're estimating that 15 million people will apply. Now, the numbers of people who are actually eligible are over 40 million. So there's over 40 million uninsured folks in this country. 100% of people never do everything or anything. So what they're estimating too is that over 30 million people will apply for coverage over the next handful of years, and that half of them will apply within that first year. So where do these folks actually live? Well, obviously they're around the country. What I like to point out here is that you have a handful of states that have really high numbers of uninsured, and I want to take a moment just for people to identify where they're at. Texas, Florida, California, New York. There are places that have a significant number of uninsured people. But regardless of where you actually live, having a significant portion in your state, like in Idaho, nearly a quarter of the folks there are uninsured, it has a significant impact on the health of your state. So although Idaho may have a really small number of uninsured, they have a very high rate of uninsured. So that impacts, the healthy workforce, because people go to the doctor when they're sicker, right? It impacts the economy because people use emergency rooms more. So it's not just about how many people you have, like California having 7 million folks or Texas having 6 million, but also like the rate of people in your state. But we do know that 2/3 of the uninsured in this country only live in 13 states. And that's where a majority of resources and information is being targeted, because so many uninsured folks live in those states. And I'll touch on that a little bit when we talk more about the national campaign. What we know about the uninsured as well is that although there are high numbers of uninsured among every demographic, is that Hispanics and Latinos are overly represented. So they're about 17% of the population, but nearly a third of the uninsured. So when you think about, if you are going to start talking to consumers about health coverage being available for folks, who are you actually reaching? And if you are reaching a Hispanic demographic, having culturally sensitive materials, having photos that reach your target demographic. Who are you reaching? Who are you serving? And then how do you actually create materials that are more relevant to them? We also know that they span a variety of income levels. So 400% of the federal poverty line for a family of four is about $94,000 a year, just so you can have an idea about this. But a significant amount of people are in each different category. And this is where majority of the uninsured are. And this is also all of the groups that will be receiving financial assistance to help pay for coverage. What we also know is that a majority of folks who are uninsured in families have at least one full-time worker in the household. So these folks are working. A significant number of them have not graduated from high school. They are working, but literacy is going to be a barrier that we need to be conscious of when actually reaching out to folks. So it's not about putting together an extremely long, lengthy, policy-driven, wordy flyer. It's about having conversations and building trust. We're continually at Enroll America trying to think about, how do we reach consumers? What do those conversations look like? Who are we trying to reach? With the majority of folks working, we also know that they're busy, right? So how do we meet people where they're at? Which brings us to this next part. So I keep referencing Enroll America, but what are we actually doing? So I mentioned earlier that we are running a national campaign, and what we're really trying to do is raise the awareness level about the opportunities that are going to be available for folks. So if 78% of folks have no idea this is coming, then we need to be that national public education campaign that is partnering with stakeholders, and really reaching out to the uninsured and then the people they turn to for trust, like everybody who's listening and watching today. It's about finding those entrusted messengers to make sure that you have the resources and the information you need to talk to the consumers. They might not be familiar with us. Our national campaign is called Get Covered America. 99% chance they've never heard of us, but they have heard of you. So it becomes very essential for us to figure out how to partner with you at the national level, at the state level, and at the local level to figure out how you can best reach out to folks. What we want to make sure that we're doing when providing you with resources and information or materials is figuring out how to mobilize the folks that you're talking to get them to apply. A lot of folks have had bad experiences in the past and may see this as a cumbersome, complicated process. So what we're trying to figure out is, what do they need to hear? What messages resonate with folks? What do they need to hear and what do they need to know to get to that place where they can apply? And then lastly, what we're trying to figure out is what are those barriers to enrollment? How can we identify what is stopping somebody from applying? Is it the system itself? Is it their access to getting a computer and being able to apply online and find out immediately what coverage program they're available? Or is it something bigger, or are we just not reaching them? So what are those barriers to enrollment? And then how can we take those lessons learned and share it across the country? You know, I have Jody Ray here today, which is so exciting. And as she talks about what's happening in Florida, we want to be able to celebrate the great work that they're doing and then share it with other states as they build their own programs. So that way we can build upon that foundation that's already been set rather than telling another state that they just need to go forth and good luck. So we want to really use those lessons learned. And we're lastly going to be using cutting edge strategies. So the Enroll America campaign called Get Covered America is a multi-pronged campaign. You know, I've mentioned working with strategic partners like yourselves. We're also going to have an earned media component and a paid media component. And then we'll be doing grassroots organizing. So in a handful of states, and when you think back on that slide where we saw that, you know, 2/3 of the uninsured live in a handful of states, we'll have staff on the ground who are reaching out to consumers, doing phone banks, going door to door, and literally just telling them that coverage is available and where they can go for help. So in a place like Florida, we'll partner very, very closely with Jody's group and make sure that we are telling folks in Florida, you know, all of the great work that people are doing and where they can go for assistance. We're not actually helping people apply. What we are is that public education campaign to raise awareness. We're going to be using data and analytics to target people we think are more likely to be uninsured than others, so we use our resources wisely. And we're going to be partnering with organizations around the country, especially where we don't have staff, to help them build similar campaigns if they want it. We want to be as useful as possible and make it easy for people to spread the word. So when you think about your role, and I know that there's a variety of listeners here, but there's a handful of best practices that apply to all organizations and entities, and we partner with a really wide variety of stakeholders. And I think that these 6 best practices apply to, you know, a hospital and health system and a community health clinic, as well as to a WIC agency or an immunization clinic. And it's looking at what are your strengths? What do you actually do? Who do you reach? You know, what kind of programs are you currently implementing? And then how can you, with just a little bit extra of work, and by that I mean if you have a list of folks, I know a lot of immunization clinics need to report whether or not they have people who have health insurance. So therefore you have a list of people who don't have health insurance. Could you send a postcard? You probably can't share your list of uninsured, but could you partner with an organization who's doing application assistance and send a postcard out to those families that are coming into the immunization clinic and let them know that coverage is available and where they can go for assistance? So it's a very small lift because I know that people are extremely busy, but it's trying to think of how you build health coverage into all of the work that you're doing. I would also add that you may reach, say, grandparents. Well, grandparents are fantastic messengers. So who do you actually reach, and are they the uninsured, or are they somebody that works closely with the uninsured? Are they somebody that has access to other consumers, or are they the target audience? And really start thinking about the population you serve. No, they have no idea this is coming, because the majority of Americans don't. And how can you reach out to them and let them know that they'll be able to apply for coverage? And this is why it's so important. So with the research that Enroll America did, and we did a national survey back last fall, and I've mentioned it, but we looked at what are those motivating factors? What do people need to know about health coverage? What do they want to know? And then we followed it up with a handful of focus groups around the country to do a deeper dive into some of the uninsured. We took that research and we compared it to the other research that's been done by CVS, by the Robert Wood Johnson Foundation, by Blue Cross Blue Shield, and by a handful of state-based exchanges that have been doing or marketplaces that have been doing research to figure out how to get people enrolled. And we put it all together to identify what are those commonalities. And what we found is overwhelmingly people want health coverage. So it's not that we're trying to sell the value of it, because people want it. What they think is that they can't afford it. And if they can afford it, it's because it's not a very good plan. And I think that that is a really important message for us to all take away, because there is so much skepticism and confusion among consumers of what's happening and how it impacts them. So knowing that they want it and they feel like they can't afford it, there's a handful of messages that consumers need to hear that really resonate with them. And once they hear these messages, they're much more likely to be motivated to apply for coverage. Those messages are going to be over a couple of slides, but it hits all of the points that I just mentioned. So one, they want to know that those plans are going to cover all the care that people need. And I think that's essential, because what they think is if they can afford it, it's not going to cover the care they need, and it's going to be poor coverage. But when you shop for a plan on the marketplace, you know that you're getting a quality health plan. You know that that has to have the essential health benefits in it. It will cover hospitalizations and emergency room visits and prescriptions. So everything that's sold on the marketplace, it sets a bar for having a quality health plan. And if you're shopping on the marketplace, you can also get financial assistance. So by saying it covers the care you need and financial assistance may be available, it covers the fact that I feel like I can't afford it, and if I can, it's not a good plan. What people also want to know is they're not going to be denied for a pre-existing condition, and that there's not going to be any fine print. Shopping for insurance is a very confusing process. I don't know if folks have had to do it on the individual market. I have my master's in public health, and I have been working in this kind of world for quite a few years. And while I was consulting, I had to shop for health insurance on my own, and I had not the slightest idea what to do. I didn't understand the language that was used. I didn't understand the difference between what if I'm hospitalized and how much do I need to pay versus I'm young and healthy, or younger and healthy, so I don't need to have a plan that covers everything. And I think that having an apples-to-apples comparison and knowing that I'm going to be paying for a plan that covers all the care that I need and that there's not a lot of fine print, it gives us that reassurance that this plan is going to cover what it's going to meet all of my basic needs. So if you say those 4 facts, you're not going to be denied for a pre-existing condition. It's going to be in simple language and no fine print. It's going to cover all the health care you need, and there may be financial assistance. We know that you're going to be reaching 89% of the population. So those 4 facts reach 89% of the population and resonate in a way that addresses their basic needs. And a majority of folks out there, unless you're one of the very few viewers that are going to sit down and help with an application, you don't really need to know a lot more than those 4 facts. The information is out there. We would love to share it. It's great to know more. But I heard a while ago, and I think it's true, you know, as consumers, as humans, we can't really retain more than 4 facts at a time, and you need to hear it 7 times in order to retain it. So in a world where we have all of this information being thrown at us, those 4 messages really answer a lot of my questions. And the one thing that I would add and encourage folks to do is also know where people can turn for application assistance. And I bring this up because in Enroll America's research, what we also said was great. You want to learn more. You want to learn more about these health coverage options. You're interested. So do you want help applying? And overwhelmingly people said yes. And when we asked how, overwhelmingly they said in person. So 3 out of 4 folks said that they wanted help applying. Now granted, this is based on people's past experience of applying for programs and them being really complicated. In all of your states, there will be people who are doing application assistance. I'll talk about that in just a moment. But when you think about what your role is and who you're supposed to be reaching out to and who you have access to and your own capacity and your own busy life, those 4 facts, plus if you're in Florida, turn to Jody Ray and she can help people apply. And that right there will get people to this place of where we found out they're at, of feeling confused and overwhelmed and worried when applying for a plan, and get them to a place of feeling secure and confident and reassured. We also asked them, how do you feel when you've applied for health coverage in the past? And that's where they started. They started at a place where they're frustrated and overwhelmed. And I don't know about you all, but for me, when I am frustrated and overwhelmed and confused, I am much less likely to do something. right? Like I want to feel confident in my decisions and I want to feel secure that I'm making the right choice. So we want to create that experience for consumers when they're applying for health coverage. And what they said is we want to do that with somebody in person.
Jessica, one of the things that we have found overwhelmingly with people applying for coverage for their kids, that getting them enrolled has given them peace of mind. So that's a message that's literally resonated for years in doing this kind of work, and it still sticks with the people that are needing to access health coverage.
Exactly. And I think that's going to be essential. And just like you said, Jody, getting them to that place of peace of mind really means letting them know those 4 facts and that also where they can turn to for help to get them there. So just a word about help, because I know that there's a lot to look at, but I just want to make sure that you all know, regardless of your state, there is somebody who is providing application assistance. The bubbles on the outside where you're looking at consumer assistance programs, Medicaid eligibility workers, insurance agents and brokers, community-based organizations, all of your states have those 4 bubbles of people who are providing application assistance currently. They are helping people get enrolled into a public coverage program or into private insurance. There are people there. What's been created through the Affordable Care Act are a few different types of groups that will provide application assistance. This could be, somebody at a community health center or a hospital or at a local food bank. This could be, a community-based organization. It could be a labor union. It could be an employer. There's different opportunities available. On healthcare.gov, as well as with Get Covered America, we are going to be letting people know where in your community there is somebody available to provide application assistance. So there's folks you can partner with locally, and if you don't know who to partner with locally, we would love to assist you in that process. So for so many people, you're not going to be actually providing application assistance, but knowing who's doing it locally will make it so much easier for consumers. So I wanted to give a little bit of an example of how we're actually reaching consumers. And the next few slides that I'm going through, what this is here's an example of what messages resonate best with women. So we know overall that those 4 messages that I mentioned earlier, those facts resonate with 89% of the population, but kind of depending on your demographic, one might be more important than another. So for example, to actually message to and reach out to women, focusing on having that your essential health care is going to be covered resonates a whole lot more than other messages. Now, that's one of the facts they need to know. But there's these motivating concepts. And, if you're putting together a marketing plan or a flyer or brochure, all of this is available at enrollamerica.org. We have all of our research available on our website. It will be essential to use that research to really focus in on your work to make it easier for you. But there's concepts that really resonate too. Many of us have had experience with friends or family members who have, either had to go into bankruptcy or had severe financial problems because they weren't able to afford the care that they needed and they got it anyways. So that message of financial security, that you're going to be able to get health insurance and it's going to cover all the care you need and you'll have financial security, that really resonates with women. And that it's a plan that fits your budget, right? You're going to be able to get financial help. Now, if you were targeting young men, or families, there's different messages that resonate. So for messages that motivate women, that's what I'm going through right now. So what we found for women is that when you say, well, who do you want to hear these messages from? Who do you want to tell you that coverage is available? Family members, providers, Medicaid offices. These are people that they assume that they would go to these places to get information anyways about health coverage, and these are the knowledgeable folks. So these are who they expect to hear the messages from, and this is who they trust. One example that we don't have on here is young men is a very high demographic or a large demographic of folks that don't have health coverage. So when we looked at, well, who are they going to turn to for information? What we found is that overwhelmingly these, young men say, well, they're moms. We said, well, who who do you go to for information? Who do you trust? Who do you want to hear this information from? And they say they're moms. So this group of ours that we're thinking of, it's the mama's boys. But these are the ones that it's not about just reaching out to the young men. It's about reaching out to their mothers, because they're not looking to a Medicaid office. They're not looking to a doctor to tell them that health coverage is available. They're looking to their mothers. So we need to reach out to their mothers to tell them that coverage is available and where they can go to apply. What we also have in our research at EnrollAmerica.org, and I just want to plug this because I think it will make a lot of your work for talking about health coverage options easier, and then also some of the work that you have is how connected are people? How connected are they online? And then we have a breakdown by different demographic groups. So one thing that we've seen is, for Caucasian women, approximately 85% of them are frequent internet users. Or for Facebook, 74% of Latinas are on Facebook, and this is based on our research. Who uses smartphones? 47% of African Americans are statistically using smartphones. So how do you currently communicate with your patients or clients or consumers or the folks that you serve? And are those communication methods the best way to communicate with them? Maybe it's not about sending them a letter in the mail. Maybe it's about sending them a text message. 79% of African Americans are using text messages as a way of communication. So who's your target demographic, and then what's the best way to reach them? So with the Enroll America campaign, what we're really trying to do is educate, mobilize, and then work with partners to ensure that we're reaching out to folks. We want to make sure that we are reaching folks in the ways that make the most sense, and that we're maximizing our partnerships in order to reach those consumers. So we partner with a wide variety of stakeholders. We partner with community health centers, hospital systems, insurance companies, agents and brokers, advocacy groups, employers, labor unions. If you have access to consumers, we want access to you. We really believe in reaching out to the trusted messenger and then figuring out how we can tap into your networks and make it as easy as possible for you to use, effective messages to spread the word that health coverage is available. So the campaign that we're running that I keep referencing, the Get Covered America campaign, this is a campaign that's really driven by using data and metrics to develop our campaign strategy, to figure out who we need to reach and what's the best method of doing that, and then how can we tap into that grassroots focus to reach as many consumers as possible. We're also going to have a really strong online presence. If you go to getcoveredamerica.org, this is our consumer-facing website. And I'm going to throw these two websites back and forth, but EnrollAmerica.org will give you the research, it will give you the policy, it will give you the information you need to reach out to consumers. But if you go to getcoveredamerica.org, that's the place where consumers can go for information, to learn more about what's coming in their state, what different events they can tap into, how they can apply. They might not necessarily be interested in reading policy papers, but they may be interested in knowing what's happening locally and where they can go for application assistance. What we're also doing is making sure that we are building a narrative of success. And what that means is that for the first time, millions of Americans are going to get access to health coverage. So we want to make sure that we are capturing those stories and celebrating them and letting people know that your neighbor, your mother, your son, your sister, your aunt, your uncle was able to get health coverage because it's only through that word of mouth and neighbors talking to neighbors and family members talking to friends. That's how we're going to make sure that people get enrolled in health coverage. And here's the website that you all can go to if you want to sign up for information for getcoveredamerica.org. And we would love to take questions after we get to hear from the wonderful Jody Ray.
Thanks. So my name is Jody Ray. I'm the project director for Florida Covering Kids and Families. We're a statewide initiative at the University of South Florida. And our focus has been around connecting the uninsured to health coverage. So we've been doing this through a variety of ways. We've worked on increasing awareness about available programs for the uninsured in the state, particularly focusing on children. So we've been in the past, because of the limitations on public health coverage in our state, Florida, we've been really able to focus on getting children enrolled. And we've been able to see, as a result of a lot of the work of the collaborative partners, including the state agencies, we've seen a reduction in the uninsured children of almost 300,000. So we know that the outreach efforts and the enrollment campaigns that we've done have been effective and continue to be effective. So while we continue to make sure that people know that these programs exist, another key element is to make sure that these people are getting into coverage, getting enrolled, keeping coverage once they've got it, understanding the program, being able to talk about these coverage programs. Jessica referenced a lot on the ability to just talk about what is going to be available, how do you access the assistance you need, and continuing to build the relationships that are needed, primarily around being able to have an expansive outreach initiative in a given area. In our case, we're focused on a statewide outreach initiative. So those partners are going to be key. I don't think Jessica could have said that enough, but it is important because there are not enough resources out there for any one person to do this alone. So the collaboration, cooperation, coordination of all the folks involved, and we've talked about the community health centers. We've talked about, the WIC programs and the folks that are doing enrollment for Medicaid now, and other community-based organizations, as well as schools. And where do people go? We want to get everybody involved because people are going to access information from different sources in different ways. So our focus continues to be on making sure that these enrollment processes are as simple as possible. That's a big piece of the Affordable Care Act, that people get in, that it's not complicated in how they apply, and that the programs, because they are going in, and ideally they're going in with a no wrong door approach. So even though on the other side of it, they may have a number of plans to pick from, some of them may be eligible for Medicaid, sometimes they have kids that will be eligible for the CHIP program. Those programs will be coordinated on the other side for the family, so it is simplified. And that we continue to do outreach to the populations that are going to be eligible for coverage. They are not going to necessarily innately know what is available, that this is available. And so it's really going to be essential that we have, I don't want to say necessarily aggressive, but definitely we want to have a very well thought out effort to reach out to these folks that are now going to be eligible for coverage. So I'm really going to focus on, so what are we doing? What are we doing in Florida? What's happening? And why do we think that these people are going to need our help? And what is being done? And what are the opportunities for getting the needed assistance in a state like Florida? So we know, it's good to know who we're talking about in a state like Florida. As Jessica's referenced, we represent a large number of the overall uninsured in the United States. We're ranked fairly significantly high, and so we have a pretty big target. We know that the uninsured and the underinsured Floridians between 100% and 400% of poverty will be able to qualify for financial assistance. So I think that's a pretty significant message because we're talking about a fairly large number of people. Jessica referenced that on a national level, but it's pretty significant even in a state like Florida. And so what we're talking about, and we're in terms of poverty level, that doesn't necessarily mean anything to anybody, but for a family of four, for example, at 100%, they're making over $45,000 a year. So a family like that, you're talking about people in a lot of cases where both people may have both parents working, or they may not have kids, but with a family of four, they probably do have kids, up to over $94,000 a year. So you're really talking about a large number of people because you're getting not just the low income. This is not just the lowest income, but this is a lot of people who are going out without insurance, even if they have incomes. We know that for Florida, we have about 2.7 million folks in this range. So this impacts a lot of people in a state like Florida. And a lot of these people will not have access to private insurance before this. They are working. The employer may not offer insurance, may not be affordable to cover the whole family. They may be self-employed. For a variety of reasons, they may not have ever had access to the health insurance market, or they may have had limited access to the health insurance market as we know it now. We know that the populations, particularly in a state like Florida, will tend to be more racially diverse. They will be less likely to be English proficient, and they may have less formal education. That being said, the need for consumer assistance will be more significant than ever before, because we're talking about folks that were, English may be a second language. So we need people that can speak to them in their own language. We need people that are culturally competent. So knowing that we need people in the field that can communicate about a topic like health coverage to diverse audiences and make sure that it resonates, it's understandable, and then they're getting that kind of assistance they need and it's respectful is going to be significant. The other key element of this is the fact that in the past people have applied for public coverage or even using private coverage have had a difficult time accessing the care they need. Accessibility to healthcare providers, particularly in rural areas, has been a challenge for individuals. There just hasn't been adequate access to care. And a big part of the law is to increase the providers out there that can give the care, so that as we're getting people into the exchange and getting all these folks newly enrolled into coverage, that they can also appropriately use care. Because the idea is that the uninsured are more expensive. They get care, they can get care sometimes in hospitals, emergency rooms. It is not necessarily appropriate use of care. It's also tends to be more expensive because, by the time they're seeking care in that way, whatever they're seeking care for is more costly to treat. And then we have to worry about how that gets paid for. So having the ability to have a service delivery system that can provide support for these folks who now can get appropriate care and preventive care and wellness care needs to be out there. So the new law invests a great deal of resources into training and putting thousands of new doctors and nurses out there in the communities, particularly those where it's needed most. Another big element of the law is that, and Jessica actually did reference this, but it's a big deal because we know that a big challenge with health insurance has been denial of coverage because somebody had a condition. Sometimes it could be a very minor pre-existing condition, something they had 10 years ago. It's not always something huge like diabetes or a heart condition or cancer. And this law has applied to kids as well as adults. The law now prohibits allowing children to get coverage because they had a pre-existing condition. They are no longer kept out of coverage. That's already there in place. The other thing is that this is going to eventually also apply to adults. So we know that more than 17 million children do not have to worry about their child not being able to get health coverage any longer, and hence health services, because they may have had or have some kind of health care condition. And this is a significant issue for a lot of parents out there who have at one time had children who needed coverage and have been left out of the insurance market completely for a variety of reasons, and that's no longer going to be the case. We also, as Jessica's already said, that kids, young adults, I shouldn't say kids, young adults can stay on their parents' health plans. This is a big deal. You look at kids that are getting into college, graduating, from college, getting out into the workplace, and a lot of times they're getting into jobs where employer health coverage is not an offered perk any longer or affordable. And so we know over 2.5 million young adults have already gained coverage because of this change in the law. And it's significant, but doesn't impact everyone in this age range, because we know that not all parents have coverage for them to stay on. But it has already had an impact on those that are uninsured and already out there, and it's already brought down the numbers on uninsured because that law has already been put into place. The other thing is that's real important is that there are now free preventive services for women that they can rely on, and it covers birth control to mammograms, well woman visits, where you can sit down and talk to your doctors. Women need preventive health care services. A lot of times they're less affordable. And now that we know that moderate co-pays that have been in place are no longer going to prohibit women from accessing and utilizing these appropriate services, such as mammograms and pap smears, and so now they can get those services when they need them to stay healthy. So as I stated, this includes, then this is probably not even comprehensive, but includes a range of the basic services that just for women alone will be provided for free as they need them. The law also prevents discrimination against women because they're women. So beginning in 2014, women will no longer be left out of the health insurance market just because of their gender. They will not be allowed to charge as much as 50% more because they're women, and that has up until now cost women more than $1 billion each year. We also know that they will, like I said, will be required to cover essential women's health care, and that includes maternity care, and that they will have an equal opportunity to purchase health care coverage on the insurance market through the exchange. I don't think we can state this enough. Open enrollment starts October 1st. That means October 1st, the application is up and running. We can start signing people up. We can start having them come in, fill out applications, or we will be coming out to the people that need that assistance to do the applications. Coverage will start earliest January 1st, and open enrollment will last through March of 2014. I think it's really important because we want people to be fully aware of these time frames, because this is the time that we're really going to be pushing people to apply that need the coverage, that don't have coverage, and we don't want them to miss these windows that are out there. So it's really important that, if nothing else can be said over and over again, October 1, we can start applying. January 1, people can start having coverage and start using coverage the way they need it. So in a state like Florida, it's really important to understand the significance that this program will have. In every group, we exceed the national average in uninsured. So this is really going to be an important law for a state like Florida, where we just continue to exceed the national rankings and in terms of uninsured. And so, it's not just children that we're targeting anymore. It's these young adults. It's the, folks that are out there, they're working full-time, they're professional. They may not have children. They may not be parents. These are people that have, for a long time, have been left out of health coverage markets. And in a state like Florida, where we have limited public health coverage for adults, public health coverage options for adults, this is going to be very significant, because now they too can get the coverage they need and will not be left out of the opportunity to participate and be able to get the services that they need. So it's really important to realize that as we're going forward, and I think a lot of great work is being done with the help from Enroll America, and in a state like Florida and any other state, there's a lot of resources that we can take advantage of. We do not need to reinvent the wheel. A lot of research has been done. We know a lot of information about who the uninsured are, what messages resonate with them, what kind of messengers resonate with them. So it's important to utilize those resources and develop an outreach plan that is going to not only meet the enrollment goals that you might outline for yourself, but how you intend to do that in your state. Because while some of these things on the national campaign look at the uninsured as a whole, the makeup, the demographics for each state don't always look the same. So the approach has to be targeted. It's important to target outreach efforts in a way that's going to best reach the populations in each individual state. It should be clear who your target populations are. Make sure you have some clear objectives some ideas on how to work with the media. I know that's going to be a big part of the national campaign, but even working at a local level, at a community level with the media to get messages out, it's going to be important. So those relationships as part of any objective is going to be significant, because we're going to need to reach large numbers of folks in a very short amount of time. So how and who we're working with is going to be key. Also having the right partners at the table and involved is going to be key, because looking at the messengers, you need to be working with the right people that can reach those messengers, that can reiterate and reinforce the messages that are going to be necessary to reach specific populations in specific areas. It's important that we are always going to be consistent with our messages, that we're clear, that we're keeping track of what we're doing. So in a state like Florida, it's wide in terms of geography and demographic. We know that literacy levels are going to be a challenge. We know that we're dealing with, and this could be in every state, folks where disabilities, physical disabilities can be a challenge. Not everybody can sit down and fill an application out just online just because it's there. That is not an assumption we can make that makes it necessarily accessible for everybody to apply. So when we're looking at how we're doing outreach, we need to make sure that we have the right partners using the right information. We're using consistent messages. We're using sound data to support what we're talking about. So our priorities for implementing outreach in a state like Florida that's going to be a federally funded marketplace, these are some of the things that we have to keep in mind. We have to look at how diverse our state is. We have to be very aware of how many different languages we have in Florida. There's no one-size-fits-all approach to outreach, and I think it's important to look at, not just look at your individual state, but look at, how diverse it is, and you almost want to break it down and look at down to the community level. And involving the community and designing those outreach efforts is going to be key, because that individual grassroots support for getting that information out and driving people to the enrollment assistance is going to be a team effort. It's going to be a coordinated, collaborative effort. It's going to be working with folks like Enroll America, as well as working with the folks that are on the ground in your own state and connecting those dots. So again, making sure that it's adapted for specific locations, and looking at your community resources, making sure that you're culturally competent when you're communicating about health coverage. Affordability and issues like that are going to continue to be important to be aware of. But then how do you communicate that to different populations is something you're going to have to be conscious of. And you're going to have to take these things into account, because, while we know affordability is an issue, and working with moms to communicate to, say, young adult men is a good approach, well, we're looking at, in some cases, young adult men who may be, Haitian Creole, or they may be Hispanic, but they may not be necessarily from one country or another. And so you have to be aware of these things when you're talking about the ideas of something very personal, can be very personal, when you're talking about health coverage with individuals. So it's extremely important to utilize the resources that are out there for designing an outreach plan that is basically going to be impactful in a given community, and realize that you're not going to be able to do a one-size-fits-all approach. That goes back to why it's so important to know who are the right people to have at the table, who are going to be the best stakeholders to have in the conversation about how do we reach a given area. We want to make sure that we're using approaches that can be impactful in a positive way. We want to see the numbers. So being able to keep track of what we're doing and knowing what is working is going to be real important. So keeping track of what we're doing as we're pulling this together in a state like Florida, who do we have at the table and how did we do it? And if we're getting people into the program, we need to be able to talk about that. That's how you get the best practices, and that's how you get the practices that can be reproduced. That's how we can look forward to the next open enrollment period and actually have something to walk away with and say, you know, this is actually what worked. And because this is new. While we have been dealing with the uninsured, and some states have provided coverage for a range of age groups and childless adults, for a lot of states and for a lot of communities, this is going to be very new. And the fact that we're going to be talking about health plans and all these available choices and be talking to them about how to pick a health plan, you know, for a lot of folks, this is going to be a new activity. And so we all have to be paying attention to what is going to be most effective, and what is most effective where, and what is most effective with whom, and be able to keep track of some of those practices that we're putting into place. Some of them have been already proven to be effective, as we have done outreach and enrollment for children and for programs like Medicaid and the CHIP program, and we will be able to pull from those, I think, to be able to implement an outreach program, particularly in a state like Florida, because we know where the uninsured are. We know a lot of information about the uninsured in Florida, where they are, what they do, what their habits are. We have to reach them where they are. We have to reach them where they work. We have to reach them when they're out there doing things that don't seem to be obviously related to enrolling in a program like health coverage, but sometimes that's where you need to best reach them, when they're shopping, because outreach is really about getting to the consumer where it best suits them. So in Florida, that's going to not only include a good outreach plan, not only include using good data and good research to develop a plan and understand who the folks are that we're trying to reach, definitely understanding the lay of the land in your own state. Transportation may be something, for example, that may make it difficult for somebody to just show up somewhere just to apply for coverage. It already is an issue. So you need to be able to address that. Looking at not only transportation, but like I said, you know, we could be looking at language barriers. So it's really going to be key to make sure that our application assisters are in places where people can access them. So what we're looking at for a state like Florida, because we're a federally facilitated marketplace, is we're going to have both navigators and consumer assisters that are going to be trained. They're going to have to be properly trained and complete training that's developed by HHS, Health and Human Services, to be able to provide that actual one-on-one assistance. So, you know, there's not just going to be anyone out there who can sit down and talk about the marketplace. We're going to have quality trained folks that are going to be in these communities, that are going to be able to address the language barriers. They're going to be able to work with folks where disabilities might be an impactful rationale for them not accessing assistance. We're going to have people that are culturally competent, that are going to be working with people who have literacy issues and language barriers that are incredibly diverse. And they are going to be working one-on-one and connecting these folks to coverage. So they're going to be in communities all over the state. They are going to be both on-site. They're going to be providing in-person enrollment. They're going to be mobile. We've got, you know, people are going to be out there driving to where the folks are. They're going to meet them where it best suits them. So when I say a variety of environments, it could be anywhere in a given community. They are going to be from one end of the state to the other, and one of the things that's going to be real important is that we're working cooperatively and coordinating with the Enroll America folks that are going to be all over the state. So as they're out carrying the messages, about the marketplace, and they're knocking on doors, and they're going to town hall meetings, and they're going out to community events, that they know where each and every navigator is and every consumer sister is in every community. So coordinating that, making sure those lines are constantly in communication and connected so that it's not up to the consumers to figure it out on their own is going to be a key part of how Florida is designing its outreach and enrollment program. Obviously, we're going to be using the technology. There's going to be the advantage of having online applications. So when our folks are out there, they've got iPads, they've got laptops. They can be anywhere at any time. And that's what we see as effective now. We've seen in uninsured children drop almost 300,000 in a state like Florida. And that mobility and accessibility is key. And utilizing technology to get information out, like some of the ideas that Enroll America is going to be doing, that the Jessica reference is going to be essential because we know a lot of these folks already use technology to get their information. We know that people, when they want to get information about a medical condition, they Google. And that's their source of information for healthcare sometimes. So we know that getting information out to people using resources and a variety of resources, not just the media, not just the social media, but the human resource is going to be important. So those trusted folks that we have in the community, like the Healthy Starts or the folks in the WIC program or the community health centers that are already providing services, these people are trusted. They know their community. They are the ones that we need to make sure are on the front line because families and individuals trust them already. They will listen to them. So important element to being able to provide the assistance is knowing where the folks are that are going to need the assistance. So obviously finding the uninsured can be a challenge sometimes when doing any outreach initiative in any given area. So again, going back to understanding what the demographics are and using sound data to find them. Using the small area health estimates, census data, using free and reduced lunch data would still be helpful in identifying uninsured adults. SNAP, even using current Medicaid and CHIP data can help identify where the uninsured are. I would recommend using as many data sources as you can to build a profile on a given area. You want to reduce the sort of gaps in your data points and just make sure that you have a complete picture of who you're trying to reach. It's probably not enough just to use one data source and assume that you're very well versed on what your demographic is and where they are. Look at zip code data. A lot of counties collect zip code data and uninsured data in a given area. Take advantage of the local level data. Look at your local resources and what kind of data they keep, because sometimes you can overlap that with some significant data sources that are already out there. So nobody's suggesting going out there and necessarily right now doing your own data research studies at this point to figure out where the uninsured are. We already have a lot of that information. And so at this point, our goal is to use the information we have, build the best profile you have so you can really narrow in on where the uninsured are. So these are the things that we're going to be doing. We're going to be doing, obviously, a lot of coalition building, a lot of grassroots outreach. It's going to be obviously working in coordination with organizations like Enroll America and other organizations that have advocated for health care that are already out in the communities. Providing the application assistance through the navigators and consumer assisters. We're going to be utilizing communication strategies, a wide range of them. We're fortunate enough that Enroll America is going to do a lot of communication outreach and media outreach in a state like Florida. And I know Florida's not the only state that that's going to be done in. Engaging a lot, continuing to engage partners and bring them to the table, and it may be partners you haven't worked with before. Because we have focused a lot on children and uninsured children or families in the past, we're going to be casting a wider net now. So we've got to bring more partners to the table that we haven't worked with. And in some cases, it really helps to bring in those unusual suspects, as I like to call them, the people you may not necessarily think work to do anything around health care or health insurance or the uninsured, but they work with people. They work with people, they're out in the communities, so they may still be your connection point. And obviously the ongoing of educating consumers and training of our community partners is going to be a really key point, because we need more people out there that understand the information that we're providing today. We're going to work very closely with the navigators and the application counselors and the federal community health centers. I know they got some resources. They received some awards to be able to do outreach and enrollment. And they're a trusted resource in a lot of communities that in a lot of ways are hard to reach. And they're already there. They already have those relationships. Obviously, figuring out where the best places to locate application sites so people can get to them, and making sure that we have enough folks who understand how to facilitate selecting qualified health plans. That can be complicated for people. Jessica talked about her own personal experience in trying to pick a health plan. That can be across the board. That's not necessarily a commentary on somebody's education level or language level. That can just be difficult. So we need people who are giving sound, trusted advice and assistance in making these decisions that best suit them and suit their families. Making sure that when people are out in the communities, they are making referrals to the appropriate places if they need assistance, if they have any challenges, that they are using all the resources available, especially when we're dealing with individuals with disabilities. We need to make sure that that the folks that are navigators or consumer assisters know what tools are out there so that they are appropriately assisting those individuals that need that specialized assistance. And then again, the implementing effective communication strategies, using the effective messages that have been developed by the researchers that Enroll America is working with, looking at the messages that we know have been effective in the past, and then and also the most appropriate messengers out there to carry those messages. So I'm not going to reiterate what Enroll America is going to do yet again, but they're going to be a big help when the open enrollment comes up October 1st. And the Get Covered America campaign is going to really complement the outreach efforts that we're doing in Florida. It's going to be real important to have those in addition to the bodies on the ground that are doing the one-on-one assistance, because it's going to reinforce the messages that we need to get out there and then drive them to those folks that we have out in the community that can provide the assistance. So again, making sure that we have all hands on deck, a wide range of people at the table. These are obviously a lot of folks that have contact with individuals that are going to need this assistance. So maybe, making sure that we're diversifying our partnerships, that we're not duplicating what we're doing, that we're saying the same thing, we're being consistent, we're maximizing the resources that we have out there, that we're making sure that we're getting feedback on what is working. Consumers are going to be some of the best spokespersons that we have. They are now, and looking at how people are getting in and listening to what they're saying, so that we're continuously having a feedback loop in place for improvement. And that's going to be real important. We need to have that in place. Obviously, we have, we're going to have folks located in areas of high uninsured around the state. We know that people are going to be contacted in their homes. We're going to be talking to moms and neighbors and friends. Enroll America is going to be doing that. We're going to have navigators that are going to be doing that. We're going to have community partners that are going to be doing that. The coalitions should be focusing on this. It's, like I said, it's an all hands on deck. So it's going to require all of these folks involved, looking at churches, schools. This is not a comprehensive list, and I did not exhaust the list of folks that will be involved, but you should see how and think about how to diversify your partners so that you can reach what is really the uninsured, because they're a diverse group of people. Obviously, reaching out to existing coalitions is going to be important. So looking at where you already have those coalitions in place, getting them educated, get out there, get them educated, get this information out there. We don't need to suddenly go out there and build necessarily new coalitions. We need to have the coalitions that are already out there working with individuals and folks in need and make sure they're trained, that they're able to provide information, direct them to the needed assistance, continue to educate their own consumers about the marketplace and their coverage options, increasing awareness. Again, making sure we're all being respectful culturally, recognizing language barriers and other kinds of challenges that may make it difficult for someone to actually just get out there and seek out coverage on their own. So there you go.
A lot of interesting information from you, Jody, and from you, Jessica, just about the Affordable Care Act in general, what Enroll America is doing, kind of taking a look at some of the things that Florida either is doing or is going to be doing to try to get the outreach out there to get people enrolled and get covered, especially if most of them don't know about it. Obviously, big work being done, and even more work probably still needs to be done to make sure we reach out to those who need the information. This is the time where I'm going to remind you to take advantage of these last couple of minutes. If you have any questions for either Jody or Jessica, now would be the time to call or email in. I will kindly remind you that this is not a political platform. You are not to call in and express your views on this particular issue, but we will be happy to answer any questions you may have about what Enroll America is doing or what Florida has done as far as their outreach strategies are concerned. I will turn to our audience in the studio to see if they have any questions at the moment. None from our audience? Anything? No? No?
I would be curious
Go ahead, Chris.
to hear what you know about with the wellness part of the plans. I don't know how much you know about that piece of it. Health insurance generally is to cover people who are sick and address illness. I think one of you mentioned wellness as part of is that part of it? Is it, do you know any more about that part of the plan?
So all of the plans that are going to be offered through the marketplace will cover all of the care, the basic care that people need. There are, and this is going to sound a little wonky, but there are 10 essential health benefits. And what that means is that all plans in every state will have to cover these 10 essential health benefits, and those include preventative visits and preventative care like wellness, as well as maternity care and ambulatory services, and a wide range are in these 10. Now, every plan is going to be a little bit different based on where you live, and we actually don't know what's included in the plans yet. What we do know is that if you purchase a plan through the marketplace, it will have that platform. It will be that baseline where it will cover the care you need. And then when it goes down to the nitty-gritties of what that looks like when you go to the doctor, we're still waiting to find out. What we do know is that the plans that have been released in a few states like New York and in California, they're comprehensive, and they're also significantly cheaper than they've been up until now. Do you have anything to add to that, Jody?
Just, when you're looking at folks around healthy behaviors, and it's the premium cost incentive for having healthy behaviors, such as not smoking, is going to be impactful for people, particularly whether they smoke or not smoke could affect in a large part the cost of what someone has to pay out of pocket.
Okay, that help? Very good. Okay, we have an email question that has come in. They're asking about secondary coverage. Will people be able to get a secondary insurance coverage from the marketplace? For example, a patient has Medicare but would like to get a secondary insurance coverage plan. Will they be eligible to purchase a plan? If so, would they be eligible for the financial assistance if they meet the income requirements?
I'm not sure I know the answer to that.
Jody and I are both looking at each other.
Yeah, because I think the assumption is you have people in Medicare, and then you have populations that are eligible for CHIP and Medicaid, either depending on whether the state has put a Medicaid expansion in place, and then in between. So even looking at I think in the ages, I think the purpose of the exchange or the marketplace is for those people that fall sort of in between. I cannot qualify for Medicare, but will they be kept out of the marketplace if they have Medicare? I'm not sure I really know the answer to that for sure.
Interesting question. Where could somebody turn to for maybe more information on that particular topic? Enroll America, or?
It's a great question. I would actually send them to healthcare.gov to sign up for information. And at healthcare.gov, you can get a lot of those types of questions answered. What happens to my Medicare? What happens to my coverage? What does that look like?
Okay, very good. We've got a couple more minutes here. I just want to give folks just another minute or two if they've got any more questions to send them in. Why don't we go ahead and reiterate some of those important dates? I know we had a lot of them. I know that they're important. So why don't you go ahead and reiterate some of those important dates for folks out there to remember and keep in mind?
Absolutely. So people are going to be able to apply for coverage starting on October 1st of this year. And that the most important period to remember is October 1st to March 31st. And that is that open enrollment period where we want to make sure that tens of millions of Americans know that there's coverage available for them and that they can sign up. Their coverage will start on January 1st of 2014. And I want to pick up on one thing that Jody said earlier, because as she was talking about Florida, I think it's absolutely essential for people to keep in mind that regardless of where you're at, what Florida has done is exemplary. There has been so much great work done, but every state has similar coalitions. I'm sure you all are participating in some kind of group. So you don't need to create this network. You don't even need to do all of the outreach to get people enrolled. Think about who your own network is and how you can tap into it, because know that there's groups like Jody's that are pulling all these folks together to actually reach out and get folks enrolled. So your goal is to tap into those groups rather than have to rebuild it.
Okay, very good. I will leave just the last minute or two here to both of you to share your final thoughts, the most important things people need to remember as they leave here today. Jody, you want to start?
Sure. I just think it's important to be aware of the fact that not only are there, key dates to be aware of to get enrolled, but that there are going to be resources out there to help people get the information they need. So it's not necessarily necessary that everyone out there know everything they need that is out there about Affordable Care Act. Everybody doesn't have to be an expert, but we are going to have people out there on the ground that are going to be accessible, and our goal is to make sure that folks know where they are and how to get to them. So that help is going to be in place in all the states, and so I think that it's really important to know that, and then you can ask the questions that you need as it is impactful to you as an individual needing to get coverage.
Jessica, final thoughts?
I just can't reiterate enough. People want health coverage and they haven't been able to get it. So this really is that opportunity to let everybody that let them know that coverage is going to be available that covers all the care that they need, and that they can get financial help paying for it based on their income, and they're no longer going to be denied. And also knowing where they can turn to for help, like Jody said. Getting that message out there and letting them know where to go to apply will be absolutely essential. And if folks do want more information, they can go to enrollamerica.org. They can go to getcoveredamerica.org for stuff that's consumer facing. They can also go to healthcare.gov if they want to sign up for regular updated information.
Very good. Thank you, Jody and Jessica, both for being here and for the information. It's certainly very useful to our folks out there.
Thank you for having us.
And if you need any of the information that Jody or Jessica presented today, don't forget you can go to our website, print out their handouts. They've got all of those email addresses that they mentioned. There's a lot of great resources for you. Their contact information is also in there if you need to reach them for any reason at all, but there are certainly enough resources in there for you to take advantage of if you have any additional questions. Don't forget you'll have to register for this program, and you can do so at our website, which is listed there for you on the screen. This does conclude today's program. We certainly hope you learned something beneficial and something that you can use in your communities, and we do hope that you'll join us back here again for a future program real soon. Until then, have a great day.